A very good day to everyone, and welcome to ISCCM's Vodcast series. You know, every month we come up with these really interesting topics and a wonderful set of panel. And here we have a special edition Vodcast, basically to celebrate our real heroes, the nurses, on International Nurses Day. To a very happy International Nurses Day to all my nursing fraternity out here. We are really happy to have this small chat show here today. And we take this day as an opportunity to express our heartfelt gratitude as well as our congratulations to the selfless work that you people do in the literally the war front. I mean, this appreciation goes out to all the nurses, but in particular to my fraternity. I'm sorry to say my fraternity, because my fraternity of critical care nurses, they really, there's so much of chaos, emotion, conflict, so much. ICU is a place of confusion, and to sail through that shift and to be able to come back, those long night hours, doctors, multiple people, multiple teams coalescing, it's a real challenge. And I have to give it up to the fact that they put it up really well, despite all the challenges. So here we have today with me Dr. Reshu Gupta, who will be moderating the session, myself, Dr. Raymond Savio. We have two very, very enterprising and leading people in this field of nursing. I leave Dr. Reshu to introduce our speakers for today, and we'll move on with the session. Thank you. Dr. Reshu, over to you.
Thank you, Dr. Raymond. Again, wishing all of you, my viewers, my esteemed speakers, a very, very happy International Nurses Day. And I'm sure, as I always say, the nurses are the main pillars of any hospital, of any healthcare organizations. We cannot run, even if we doctors are not present there, the hospital can still run on the nurses. So that is what you all are for us. And today we want to just dedicate this day, dedicate the whole session on you. So for that, we have with us today a very well-known name in nursing fraternity. Not only that, even amongst us in critical care fraternity, Ms. Thankam Gomez. She is the nurse entrepreneur, founder of the CEO Signia Healthcare. She is a mentor, she is a leader. She has trained around more than 10,000 nurses under her. She has been a guide to many of us. Even I have learned so much from her during so many sessions where we have interacted. So I welcome you, ma'am. Thank you so much for being here with us. It's a real honor for us to have you here.
Thank you very much. It's a pleasure for me to be here.
Thank you. Then we have Ms. Susan Matthew. She is the Chief Nursing Officer from Apollo Proton Cancer Center, Chennai, right? Thank you, Susan ma'am. Thank you for joining us in such a short notice, both of you. So I'm sure we will be having a very, very interactive session today. Over to you, Dr. Raymond.
Yeah, so of course, we all know, but we would like to hear it from you, ma'am. Maybe we'll ask Tangam, ma'am. Why is this Nursing Day actually being celebrated? What are we observing, and what's the little bit of interesting history behind this?
So let me keep it short and sweet. I'm sure that everyone knows that May 12th is the birthday of Florence Nightingale, and it was started in her honor. She's the mother of modern nursing. She's the one who actually made nursing a science and an art. And she's probably one of the earliest statistician that has been recorded, because her rose diagram had been so famous. So this was then endorsed by World Health Organization, then International Council of Nurses. So across the world on May 12th, it is celebrated as International Nurses Day. Some of the countries may have National Nurses Day separately, but almost all the countries, at least in my experience wherever I have worked, it's always May 12th. And then this is actually an opportunity to recognize the role of nurses in healthcare delivery system. If I can be a little candid, in it has become kind of a self appreciating event. So someone asked me someday that how come that when Nurses Day come that you are the people taking lead in celebrating? It should be somebody else who is celebrating. Then I told myself, oh yeah, that's a very good question. Why are we celebrating ourselves, which somebody else should be celebrating? We celebrate Doctors Day, then why somebody else is not celebrating? That's a good question, not yet answered. So I think this is one day where nurses just rise up and say, "Hey, we are here," and the same story continues. People call us backbone and the heart and the brain, whatever. So today I was telling, I was putting out to somebody else. I was saying that why do you call us the backbone? We are the system. I always say, the doctors and nurses are the two sides of the same coin.
Of course.
You cannot be complete without each other. So I think this is the day where, a lot of very serious work is also done. WHO has put out a report. ICN, the National Council of Nurses, have put out a world nursing report where the two reports, one is on manpower, the manpower of nursing across the country, and definitely that's where all the challenges are sitting. And every year International Council of Nursing will put out a theme for everyone to work around it. It is not only about celebrating nurses and recognizing them, it is also about committing to do something better for that workforce, which literally hold the healthcare delivery system together. So I would stop there because I can go on for hours if you ask
So
me.
I'm so
So
true.
that
I
is
So that's
how
what
it
I
was
think
for you.
every institute, we do not only celebrate 12th of May, we actually celebrate the whole week. And it's so much fun to see these nurses doing sports activity, cultural activities, even in my hospitals and even in other hospitals. When I see the statuses and in social media, it feels good. So maybe I would say, ma'am, if the question to that answer, is it because they just want to celebrate their profession? They would just want to be happy, more than happy, and that one week they choose so that they can just let out all their stress, because I'm sure you all must be in such a stress working in, especially in critical care field. So maybe if
I
that is the
totally,
thing.
totally agree with you
Yes.
because I'm a critical care nurse myself. So I would have loved to be there only if I would have been paid better. So I had to come out of critical care
I
to
think that,
earn
that
more.
that thing would be from many of the nurses here. So moving
Dr.
forward,
Reshu,
Suzanne.
just a minute.
Yes,
So I
yes.
just want to make one addition to that history. So interestingly, did you know that Florence Nightingale is not just for nursing? We have something in common with her as well, because when we talk about the history of critical care also, it is quite possible that she is one of our, forerunners, because apparently she
Yes,
is the one who first cohorted the sicker patients
yes,
closer towards the nursing station.
yes.
So that is probably the first ever concept of an ICU. So we share her, both of
Oh yes,
us.
of course.
Anyway, back to you,
Okay.
please.
So, Suzanne, ma'am,
Yeah,
what inspired you to become a nurse? And what do you think nurse means to you? Like that word nurse, what do you think?
yeah. If you say ask me about the inspiration behind my being a nurse, was basically like whenever I saw someone in illness, in sickness, I used to empathize with them automatically. It used to come from inside, and I couldn't see the suffering. That was my part of it. But at the same time, I had an inclination towards a medical background. I wanted to become a doctor. But as I had lesser grades at those times, like we had to be on par with that upper class. So, and I was not on side of giving a donation and getting into nursing, into the medicine, because I felt that I should be excelling in what I do. So I got a part in the nursing, and I did my nursing course, BSc Honors Nursing in Rajkumari Ambedkar College of Nursing. So that time we were equally as good as the doctors there, because we were given equal exposure, we were given equal time from by our professors. We used to get professors from in-house, and that was real inspiration that I wanted to be helping out to some needy. That was my inspiration. Second thing, being a nurse is empathy, compassion, and love. At the same time, dedication is equally important. These are the three things that I will link to a nurse. She needs to have empathy and compassion in her to the maximum. Then only she can work as a bedside nurse, and only she can give out her best. That is what I feel as a nurse should have.
So true. So true.
Yeah, absolutely, isn't it? So there's always this compassion and sympathy and all that that goes into the making of a nurse, especially again a critical care nurse. So by the time they enter the ICU, it's I started off saying a zone of care. So, ma'am, both of you, we would like to hear from both of you. We know that there are a lot of challenges. Any profession is going to have its own set of challenges, but we personally feel the ICU nurses go through a hell lot of them. Because in our perception as a doctor, we see a certain set of challenges. We would like to hear from you as to what are some of the unique challenges that these girls working in critical care units go through. We can start with Gomez ma'am, and then Susan ma'am can also add on.
So, I have spent almost 16 years in critical care, another 12 years as a nursing administrator. So, I would like to put this into two buckets. The challenges the nurses themselves bring on, and the challenges which are there in the environment. The challenges that nurses themselves bring on is that many a times critical care is seen as it's a very very creamy, or the crown of hospital, so everybody wants to get into critical care. So whenever I used to interview nurses, if I ask them that where would you like to be assigned, so 9 out of 10 will say I would like to go to ICU. So then I need to ask them, do you know what you need to get into an ICU? So that is one challenge. They're not aware what is in stock for them inside the ICU. And I think the challenge also remains that we do not give them enough time to prep themselves to get into the ICU, life and the chaos, the resilience that is required. So just extension of Susan's answer when the question was that what is that you need in a nursing? I always say KSA. It's not Kingdom of Saudi Arabia. It is actually knowledge, skills, and attitude. Attitude will cover your compassion, your communication, your collaboration, your teamwork, everything else there in the attitude. But it's very important for any nurse, and in critical case, even more important, the knowledge and the skills. It is there in place because, and in these skills, one of the most important challenge I'm sure that you also may be facing. So when I was a critical care in charge, I was literally focusing on the clinical reasoning power of nurses, because that's where I think all the intensivists will be dependent on them to be the right, making the right decisions at the right time, escalating at the right time, taking the right actions at the right time. And this does not happen overnight. It happens with experience. So the other challenge I told you, I can talk more, but I'm very aware of the timing in the environment. So I have only one thing to actually submit here is that being a critical care nurse, what made a whole lot of difference to my team when I was working abroad. I was the head nurse, and I had a team of 40 to 60 nurses. What made a difference was my intensivist, the HOD of my ICU. Dr. Vijay, in case he happens to hear this podcast anytime, he's my guru. And Hamesha, I will say naman to him, because he showed the way that how an ICU should be prepared and nurtured, where the nurses actually become the pillar of patient safety. So assertive, speaking up, and he trained the nurses. He took time. When I came back to India, I really wanted to duplicate that. I said, it happened there, it can happen here. So I'm going to share some very hard truths here. When I started my, journey here as an administrator, the first challenge I found was that my intensivists were not the ones I met abroad. They had very big egos, extremely big egos, which always saw a nurse below them. So I had met some excellent intensivists during my journey in Fortis also, I must admit that. But I still didn't find what Dr. Vijay gave. The freedom to participate in the round, to be there. Maybe there are, excellent examples across other systems, but I'm talking about my own experience. So one day I told one of my intensivists that if you want the nurses to really rise up to the occasion that you want, do only one thing. Every day in the round, ask the assigned nurse to present the case first. Have that little patience, let that nurse present, and you will see miracle happening after that. Because I have seen the young nurses, they're okay not to look too smart in front of me, who I'm like a mother, nursing head. They're okay with that. I'm sure that Susan will also agree. But they definitely don't want to look small in front of their doctor colleagues. So they will read, they will learn when they're going to present. I think it just was sustained for a week or 10 days, and then it kind of fizzled out because you need rigor and discipline to put in some rituals into the ICU life. And after all, we all are a team, right? And I have seen the intensivist who will come and fight with me tooth and nail during the performance appraisal. That's a different story. They are so much in love with them, but on the daily routine, the focus is not on enabling and empowering them to grow to that level of decision making, the clinical decision making, which is very critical in a critical care. Because I'm sure that both of you will agree, you will have peace of mind when you look at some nurse's face.
Yes.
Of
And
course.
you will be worried when you look at somebody else. You say, oh my
Correct.
God, hey, oh God. And some you say, ha, chalo, aaj shanti hai.
Absolutely.
Right. So I would like, this is what I would like to summarize. There are many other challenges which are there, but since it is a, critical care doctors who are speaking to me, I'm just greedy to share what you can do to make nurses, grow faster and adapt themselves to that chaotic, confusing environment. You need little patience and support. And that's what the nurses can work any amount of time for a patient, but they need a little bit of understanding from the doctors. Why not give a chair to every single ICU nurse to sit? Because it's not possible. You never know that when can they sit in critical care. So I was told many, many years ago when we were abroad, my director used to tell me, Tankam, please sit when you get time. Otherwise, you don't know when will you get time. So when I came back to India, when I proposed this, it was like, I was telling something totally wrong. Why should you give a chair? I said, there are days that she will never sit, or she or he will never sit for 8 or 10 hours. They're on their feet, just like the doctors. So I think those little changes in the environment can go a long way. And things are changing. I've heard some excellent stories from some of the nurses that, how supportive the intensivists are. But just like the challenge we have in our profession, having just the cream right on top this much is not good enough. Maximum of the nurses should be shining to say that we have arrived. And I think you can definitely help us to arrive there.
Thank you. I think you have given us very important message, Gomez ma'am. Like few things like, yes, you have to try to talk to them and bring up them to that level. And one more thing which I really loved about from your talk or your words, like that nurses and doctors are the two parts of the coin. So they always go hand in hand, and we need to support them so that we can raise that ICU to a level. So I think whoever my friends who are listening to this podcast, I think this is a very important message which is being shared. And maybe if we can start incorporating it, I think we can make a difference, isn't it, Dr. Raymond?
Absolutely, absolutely. And I'm sure, in the ICU, there are a lot of changes that have been happening of late. Like rightly pointed out, things are probably not as they were a couple of years or a couple of decades ago. Things are changing. We've started talking more about nurse empowerment. We
True.
want them to know what they are up to. We would like them to get academically strong as well. We help them participate. Of course, ISCCM in a big way. Uh, I'm sure you are aware about the diploma courses that are run for the nurses and the kind of teaching sessions that happen every month. So there's a lot that has changed, at least in the field of critical care nursing, definitely. And we look
In the last
forward to
5 years, true.
greater empowerment. We can hear a little bit from Susan ma'am as well.
Yeah. Yeah, I'm very happy to be a part of this conversation because as I was in Continental Hospital, we had diploma nurses having the same courses. Our nurses were doing the same IDCCM courses. So, like it really empowered them to have that in at par with the doctors there who were coming for the doctors who were coming for the same courses. So they felt empowered that they are also being given a chance to go and have these courses, do these courses. But at the same time, as Gomez ma'am rightly said, that the nurses are not given the due appreciation when it is required. Actually, in the critical care, as rightly pointed out, they spend hours and hours taking care of the patients. Like literally, the doctor may not be there, but one nurse may be there when a patient is very sick, and round the clock she's monitoring. And the lack of recognition sometimes, I do say that sometimes the management or its deficit from our point of view that we don't recognize them as they are being doing some exceptionally good work. If I think they will be well motivated if we really recognize them on their day-to-day basis, how they are doing. At the same time, we are in one of the world's best hospitals. Right now, I am in Apollo Proton Cancer Center. We are being given all the equipments, all the resources are available. But there many hospitals where they may not be having the adequate resources also. They may be struggle with the systems, the computer systems, the instruments, the monitors. All this, the nurse is the one who faces the challenge. She is the first one to get a equipment ready. When a patient is being received from the OT with a CABG done, she has to get 5 pumps. She has to get 10 pumps ready, fluid ready, everything. So she's a multitasker there, where she's arranging things at the same time she has to take care of the patients. So, being in one of the best centers right now, I can say that our nurses are being helped out, but there are many critical care nurses who are being struggling with all this, and with that, they are giving incredible performance. Actually, to say that they are the one saving the lives of the patient once they are in after the OT, the patient is put in their hands, and they are the one sustaining the life of the patient.
Can I share a short story because Susan just mentioned about incredible results. So can I share a real
Yeah,
event?
yeah, ma'am. Go
Yeah.
ahead.
So this was when I was the nursing head, in one of the hospitals. So whoever is listening, they will keep wondering whether it is Mohali or Vasant Kunj, but I'm not going to tell which one. So my intensivist barged into my room and he opened and he said, Tankam, your nurses are hopeless. I am fed up. So I had to ask him, please come inside. He said, I said, have a seat. Then he said, no, I don't want to sit. I said, oh, if you don't sit, I will stand up. So I literally stood up and he was a good friend of mine. I used to be friendly with all my intensivists because being a critical care nurse, I used to be always, friendly with them because I wanted to learn still the clinical part of it, though I am in administration. So I ordered some teas. By the time he calmed down and he sat down, then because I had to give him a feedback. I had my own way of doing it. So I asked him, what's your mortality rate? You know, I had all the dashboard with me. So he said, oh, he's one of the best. I said, okay. How about CLAPSI? Oh, last 6 months, no CLAPSI. I said, oh, wow. I said, okay. So all the quality indicators are fantastic. So I told him, congratulations for achieving all this on your own. So he was quiet for some time, and then he looked at me and he said, बहुत शानी है. So I told him, I just told this not to paint every nurse with the same brush. I know when you are upset, there is a problem. In my entire life, let me admit to Raymond and Rishu that not a single doctor ever shouted. Yeah, shouting is not good. They should not shout in corridor. I agree. But I don't think I can recollect a situation where the shouting happened without reason. But only submission is that does not make the entire nursing fraternity bad.
True.
So then he told me what was the issue. So he said some nurse put off the ventilator alarm without checking. He just silenced it. So I said, give me 2 days, I fix it. And that is my job as a nursing head. So 2 days, I did what I had to do with my ICU nurses. Then I asked, is it better? And he said, yeah. I said, it's always, a dialogue is all that is required. You don't have to.
Yeah.
I understand from where the intensivist is coming. It is from the fear of something happening to a patient, because if nurses silence the alarms without checking, it can lead to severe, damages to the patient. We totally understand. So I think that is also a requirement of the environment, that, the doctors need to have some patience to have a dialogue, to say, okay, because we cannot keep countering by saying how many errors the doctors made, how many errors the nurses made. We all are humans. To err is human, but not to learn from the error is definitely an error. So I think it has to be a collaborative way of finding solutions. And doctors in critical care, they play a huge role in fixing the problems. And when they start, extending hands, I'm sure that, the current CNOs, the youngsters like Susan and others, they are clinically aligned. This is not like the old nursing heads who were only worried about the workforce and duty rosters and everything. Now the youngsters are more clinically involved. So the clinical leadership can be developed when we join hands and plan that, what needs to be done in this ICU. What are the challenges? It's very easy for a doctor to call the CNO and say, what the hell, why we don't have 1:1 nursing here?
Yes.
Then suddenly you become two different parties. If the doctor says, ki, okay, Susan, there seems to be a problem, can we meet and see what can be done? That becomes a collaborative model. So it's a collaborative model that we should be looking at, and believe me, you will get far more better results
I'm sure this
from
would
everyone,
Absolutely,
Thank
absolutely.
you for giving
So,
me the time to share the story.
no, it's very important
It's
because
very
I
good.
also let me sneak in at this time point and also express to all the nurses who may be watching this program in a similar way. Whenever there is an exchange of dialogue, maybe slightly with a harsh note or something, it is not that anybody has a personal grudge or something. It is just that the added responsibility. Everyone is working for the best interest of the patient, and of course, yes, there needs to be some fine tuning of dialogues and conversations. Yes, but nobody means harm to the other. Absolutely.
I
Uh,
totally agree. Nobody means any harm purposely, no. But I think
Absolutely.
since the need to get better results from nurses is so acute, we have to collaborate.
yes.
Yes.
And
Yes.
I
even
think that is what ISCCM also is taking a huge step here, ma'am. I don't know whether you're aware of it. Like there are programs for nursing, the 1-year courses, which I think have made a huge difference. I don't know, Dr. Raymond, will you agree Whenever our assigned nurse I know is an IDCC and passed out, I can see the difference, because that course, that training is so intense and so very proper that I can actually make a difference. I can say, okay, if she is handling that patient, she or he, that patient would be taken care of with utmost. All those small things would be, checklist will be corrected. So I think maybe what was 15, 18 years ago, things are now changing. They are coming at par with the doctors, they are hand in hand. They are always a part of the discussion also when we are dealing with any patients, any problems. So yes, as Dr. Iman, there are sometimes harsh words, exchange of hard words somewhere, because we are there only for the good of the patient. So in those scenario, it may.
In fact, talking about ISCCM's efforts towards this, it's not just the IDCCN, but it is also the training programs and communication that we have for our own doctors. That is also very effective, and it's been really appreciated. Anyway, in good interest of time, we'll move forward. Shall we ask them the $1 million question? Attrition. Nursing attrition is so universal. It is something that you cannot avoid. But why is it that, we cannot avoid? I think cannot avoid is not really, uh, I don't know. I think there should be means of tackling this. And what do you think will be the appropriate means of tackling, Susan, ma'am? We'll start with you.
Yes, it's a very good question and rightly directed, because I had left Indian ground when I was just a fresher, like 1.5 or 2 years. So I understand the importance, because right now, today, the theme of this year is Our Nurses, Our Future, and caring for nurses can strengthen economies. That is a theme of this year. So rightly said, if we care for our nurses, I don't understand why they should be going out. They are going out, or the attrition from India, the drain is happening just because they are not being well cared for. That's what I understand right now, because their aspirations are huge, their desires are very huge. Everyone wants to excel in their professional and financial lives. None of them want to remain as just a staff nurse on bedside with just meager 20 or 30. So if I get an opportunity, I would just jump out. That's what is happening right now. But real stress is like, if we can, our government can, or our Indian government and our corporate settings, if they can really help our nurses, care for our nurses better, I don't think this drain this drain would happen, right? But don't know how it can happen. That is another question. That's a real.
That was only your question.
Yeah, that's a real good question. But one thing I would say regarding knowledge, our Indian ground is the best ground for having the best knowledge. I will not say the nurses are going out for knowledge. They are not, the skill wise, we are giving the best skill, at least in all the good hospitals and the educational institutions around. I think we are above the normal this thing. But the financial issue, that is the one that is making them to go out. But can we support the nurses in caring for them, in the sense giving a good financial support? Second thing is giving them a good conducive environment. That is for their professional growth. We should be able to give something so that they'll be able to grow here itself in their academic, in their clinical expertise, in their professional life. But at the same time, they have to we have to help them balance their work life. In Indian setting, if you see right now, if a girl gets married, she gets pregnant, she has to get a 9 months or 8 months of gap, and then she comes back. She has a small kid to take over. She has a small kid to be taken care of. But many of the hospitals, some of the hospitals which I have been working, really gave a crush option for the nurses and their employees, which really took out a lot of burden, that once they join, they don't have to leave the little one behind. Such type of caring ideas, which we can enforce in our workplaces, will definitely help them out to remain where they are. That attrition won't happen. Like, it may not be the complete solution, but I'm just giving some
Yeah,
few
I think
ideas.
a good suggestion from your
Yeah.
end.
Yeah, so some few suggestions, some few things that we can take care is like gives a good academic value, help them to grow. Being in house, help them to grow so that they will stay there and give their best in that particular institution. So these are the things that if we can, maybe we'll be able to retain them. Other than that, I think the market outside is vast, giving a very good colorful attraction to them, like little children if they show a lollipop and then call them out. So it's really attractive, it's really colorful, so that is what is making them to wow. But definitely I can vouch and say that our nurses are the best nurses across the world. If you across the globe, you see they are very well, they adapt very well, they learn very well, and their skill is exemplary. So that's why they have been absorbed into the market also.
I think so, ma'am. That is the reason why the Indian nurses are being recruited
Yes,
so in large number outside.
correct, correct.
So, Miss Ma'am, would you agree to that?
I totally agree. So excellent points made by Susan. I would like to make few more submissions from my extensive experience of being an group nursing head for Fortis with Fortis for so many years, and post that I have been interacting with so many leaders and so many nurses across the country. The first and foremost point, of course, is the salary, and that is not something. It is slightly better. Some hospitals they do pay, but it can never match what the outside salary will be for a nurse, because it's like any occupation, whether it is a doctor or a nurse, comparatively the outside salaries are definitely going to be much better. I think the most important difference is that when the nurses go abroad and they excel, like Susan told, the exposure and the recognition they get is faster and very, very evident to everyone. When you go abroad, and when someone says, well, I was in the Middle East, if a Saudi says wallahi in the Hindi, oh, you are like gold. I mean, that itself is a big appreciation. They say, oh, then it's almost like all the Indian nurses should shine better than the other expatriates who are there. So in India, that challenge is not there, I would say. So there has to be a different challenge. What is that? Today, the Gen Z, they are a different breed altogether. They are not joining nursing because there is a calling or they want to serve, nothing like that. It is just that they know it's a job and I can go abroad, and it's a attrition proof job profile. You can always get a job. If not in hospital A, I don't like it, I'll just leave and I can go and join hospital B. So this is current generation. So for current problems, we cannot be sitting with the old solutions. It has to be newer solutions. So when I think of, couple of, I keep thinking, and if I was still heading a hospital, what would I do? I will do few things. As a hospital, I will start engaging with the colleges directly to say that how can we bring in some extra. I mean, you want to develop critical care thinking, whatever, from the college itself. So they start seeing the doctors and nurses from the hospital. With current technology, you don't even have to move. And if you offer any college that we will come and give a free lecture on whatever it is, they'll be more than willing to. So you have built a relationship. Then after that, why not start a critical care apprenticeship program? That means the moment they finish the exam, you bring them, put them into a apprenticeship program. I think some of the hospitals are trying it out. But if this program is structured and endorsed by a body like yours, that means it's a critical care endorsed, apprenticeship program. And it is not very long till the time they get the registration. It could be 6 months, 6 months should be good enough. So you make a program. Diploma is a longer program, right? Not everybody will be willing to invest that time. So after 6 months, then probably ISCSM will say, if you have done the apprenticeship with the program that we have prescribed, then your diploma requirement will get offset by whatever month. So what are you planning? You are planning to keep them with you by giving them good training opportunities. So I always say you cannot stop the nurses from going. But can we plan a way that when they join a particular hospital, that they stay with you for at least 1 or 2 years, and after 2 years they say that we are going. They don't abscond. The problem now is many people just simply disappear as though the plane landed just today for them to go somewhere. It is not like that. They're planning. Why are they not informing us? Because there is also a trust deficit within nursing. They don't trust that if we inform, we will be allowed to go, or that transparent dialogue. So I am also guilty of that. So today I put out a nursing message on Nurses Day. It was a message to the leaders that it is high time that we need to look at the way that we function with the young nurses. It is nice to say, apart from we are talking to the intensive care doctors, we are saying what we want, but there is a lot of want within the nursing also. Are they being listened to? Are they being recognized? Are they being recommended? And I will be very brutally honest. I am part of the Association of Nurse Executives India. When we ask for nominations to recognize nurses, we are not, overwhelmed with the nominations by the leaders. Nobody has the patience to nominate one nurse from their organization. We have 1,300 plus nurse leaders sitting in the association. Why should we get only 20 or 21? So these are our own problems. I like to be very, very candid about it, because it's very important that we also have to put our house in order, so that young nurses, they trust the leaders, and they will come and at least tell you, this is what I am planning, and this is the plan that we have for you when they come. So I think the plan should not be how to stop them from going, because I know that we can't give the salary that we are giving. Why not they go on our terms? Not that they go out on their terms, and then facilitate. Now, sitting here, I did not think of these ideas, but when I'm looking at the YouTube, I'm sure that you will be, interacting with a lot of international ICU people, etc. Why not think of some scholarship that country may have, to have an exchange program, where their nurses come and spend couple of weeks here, our nurses go there and spend. So what happens, everybody, they suddenly they feel, we are not that shadow. We have to be abroad to be recognized, to be growing, right? India definitely has got a lot of challenges to continue the education the nurses need to do. In abroad, the avenues are multiple. You can work and you can get a lot of degrees and other things you can get, but in India it's not that easy. I understand. We are hoping the new NMBC commission, the Nurse Midwifery Commission, would have better and current solutions to the problem that we are facing. So these are some of the things that come to my mind, newer ideas. And then, of course, using technology should be smart, and there are youngsters who are tech savvy. Use them when you are designing your EMR. Ask them what are the critical care alerts that they would like to get, from the EMR itself. When you start involving them, not just the CNOs, beneath them, the talent who are working with you. Identify them and tell them we would like them to be part of this committee. There are doctors who are really championing, and I must admit today to the entire viewers, and those champions mostly are intensivists, critical care doctors and ER doctors, not anybody else. That has been my experience so far. So, so attrition, Dr. Raymond, is not a easy to tackle answer, but there are interventions multi-pronged. If we plan it together, we will be able to contain from 40, 50, 60%. If we bring it down to, let's say, 28, 30, that itself is a major number. So you have to approach in a very strategic manner. It is not a quick fix. The quick fix will, quick fix will come out that faster.
Yeah.
So
I
I
think
think both of us,
this
we told a
session,
lot of.
no. It was very informative. This session has given us a lot of suggestions, a lot of insights where maybe we can think, maybe our stalwarts and mentors, maybe they also can think about maybe your exchange program. That was a wonderful strategy. That is a wonderful suggestion given by you. And regarding the Susan ma'am, also what you said regarding the salary, maybe we can think about it. If we can have the different tier hospitals, the different tier cities hospitals, if we can fix up the salaries, like in a way, they should be the money, they should not be paid less than that. So maybe that would also bring up some motivation to the nurses working in critical care. I do not know, but
I'll just interrupt and say there is a Supreme Court order which has actually fixed the salaries,
okay.
which is like minimum 25,000, 200 bedded above. And when the salary discussion came, I actually looked into the labor law, minimum wage salaries. Even an unskilled person is due for 21,000, putting it all together. The insurance and all that thing together, the entire CTC can go between 18 to 21,000. And imagine that salary is only received in cream hospitals in India. The corporate hospitals, many of them are now trying to give them 25. And what I feel is in critical care, there has to be a differential pay. So there are two ways to. I wanted to implement this differential when I was an administrator, but I did not get much of HR support, in the sense that you bring in everyone at a certain salary. When they finish 6 months, you measure their skills, measure their KSA, and put them into A, B, C category and say, if you come out A, you get this salary. If you come out B, you get this salary. And from there, it is a performance cycle. So if we have to think very differently, so there is a difference between someone who is trying to excel in the job and someone who is just trying to barely finish their duty and go.
Okay.
So I think if we can think like that, I mean, that's what you can concentrate now rather than making a minimum. I don't know how much you will be able to do that, but at least if you all champion for this, many hospitals, they give a critical care allowance, but this differential is not there. When you start giving the differential, it is almost like giving a gift to someone for performing better, not to wait till the performance appraisal cycle comes. That is for increment. That will happen with everyone. But someone who is really asserting to be performing better, how do we recognize them? I think rather than thinking of giving everyone everything, better to think how do we give that recognition so that everybody is, looking forward to do more to get there.
True. I think due to the paucity of time, because this podcast has been so interesting with so many new ideas and suggestions coming, I think we would just like to take a closing remark from both of you in one or two lines on this Nurses Day. Anything important message you would like to convey more? Whatever you have said has been very, very informative and very, very important. But Suzanne ma'am, any closing remark or some message to your fellow nurses, to us intensivists also? We would be more
Yes.
than happy to take.
No, one thing is what I would like to share is I ask all my colleagues and all the people out there, all my staffs or like whoever is working in the critical care, even the doctors, intensivists, that really to being in critical care is very very difficult job. But at the same time, persevere and sustain what you're doing. Sustain the best if you can. If you're doing the best, keep doing the best, and at the same time fight for your rights, like as Tonya Gomez ma'am rightly said, like when she had told about the chairs being available for the staff, like when the sitting time and all. If you are really finding it difficult, I think that's just a very very minute necessity that is very, very important, vital. But at the same time, it's very, very vital. Many of our nurses end up with having varicose vein and all these health issues, backaches, just because they have been continuously standing and struggling. So take care of your health, sustain in doing the best, and persevere in the right direction. That's what I would like love to exchange to them. And really, you are doing an outstanding job. Even you all, Dr. Raymond, has been very, very supportive to the nursing team. So I'd like to extend my thanks to all the intensivists out there. Even in Continental, I remember one or two, Dr. Shashi and Dr. Ramesh and all. They've been wonderful people who are really, they support the nursing team within that uh, purview of their jurisdiction. Really, they don't leave them out alone, as Tangam ma'am said. They won't leave them. They will be there. But at the same time, when it's necessary, they would shout. But at the same time, they're very caring and very loving. And thank you for the support that you extend to them. And look forward to work with you in a much better way. Thank you.
Thank you.
So let me also give my concluding remarks. First of all, what is happening just now is a progress. Because I don't think that doctors have reached out and created a podcast or a vodcast with nurse leaders, and maybe this is something you would like to continue, and maybe bring in critical care nurses, give them this platform, and let them know that when you shine, you get more opportunities to be with the doctors. This is kind of walking the talk. I always believe that you can give a lot of great talk, but if you don't translate that into action, then it really means nothing. So you are inviting us to this, special podcast itself is an action. So thank you very much for that. And I'm not surprised that it came from critical care doctors. I'm not at all surprised. If at all it had to come from you only. So thank you for that, I would say. And to all the young nurses, I can only say Susan told her piece, and I totally agree with her. Make yourself so good that nobody can neglect you. That's what. Invest in yourself to may become the best version of yourself. Don't wait for somebody else to come and give you khana pina and everything. No. Look after yourself and make yourself so good that people definitely will look at you. And to all the nurse leaders, I think my message is loud and clear to the leaders. They really have to walk the talk. All the leaders say extremely great things in all public places, but now I am an independent nurse leader, so I get to hear from everyone. Please don't become a banyan tree that nothing grows under you. Become a nurturing tree. You give shade, you protect them, but allow them to grow, flourish, and let them become even better than you, so that you can be proud of creating many more nurse leaders behind you, not only in administration. They become clinical leaders. They can become clinical leaders even if they have 2-3 years experience. Why not? And my last request to all the intensivists, whenever you are doing any research, studies, survey, or any evidence-based practice, please involve the nurses. And I will give you one topic to get into. Can you standardize the discard volume when you take blood samples from central line?
Oh,
I do a lot of training and it is all over the place, and I think not what the literature says. So I think you people can do that research, because I think we don't need to take 10 ml, and some people they say our doctor says throw. And I have experienced iatrogenic anemia in my ICU. Then we had to go back and say, are we doing the right thing? And the standard practice, given by the bodies are very different from what we are practicing. So that is my last request. I am very greedy when I get an opportunity that I have to tell this. And please, I'll be more than willing to, cooperate and see whether we can bring out something, And coming from the body like yours will be the word for all the nurses, that whether it is adult, pediatric, or neonates, there has to be some standardization. which is not
So
there.
thank you so much, ma'am. And if I can just pull out the keywords from the concluding remarks to all my beloved nurses: persevere, sustain, know your rights, and invest in yourself. So that's what we hear from our nurse leaders. So it was a wonderful interaction today. Thank you so much for your times. And it has been a very enlightening discussion with you. And thanks for acknowledging the role played by the ICU fraternity and the intensivists as well. We do look forward to a lot of, because we have such long hours of working in common, and there's always this sharing of sympathy and compassion, and outcome directed. So thank you so much. That was a wonderful discussion. I thank the leadership of ISCCM, who are so thoughtful that they should have this podcast on a special day as this. So thanks to the ISCCM leadership, thanks to the office people of ISCCM who helped us with this quick convening of the meeting. Thanks everyone. Thanks to all the people who are listening out here. Let's take home all the good information, and let's see if we can learn out of it and make the best out of it. Thank you so much.
Thank
Thank
you
you.
very much.
Thank you.